Hello, my name is Dr. John Naranja, and I've been asked by the firm to talk about injuries, their diagnosis, treatment, and their prognosis. What I want to do here is look at anatomy and then subsequently talk about the different ways to evaluate. By way of background, I went to medical school at Georgetown University School of Medicine in Washington, D.C., after which I did an orthopedic surgery residency at the University of Pennsylvania in Philadelphia, and then I was in a clinical practice for approximately 12 years. I performed a number of the surgeries that we'll be talking about, and subsequently I've done a lot of medical legal opinions and then went back to law school in order to obtain my law degree. Since then, I've joined the firm and I've been asked to talk about these particular injuries. I'd like to next talk about the definition of mild traumatic brain injury. Now, there are a number of sources where we can get the actual definition for mild traumatic brain injury, and there's no particular consensus as to how you diagnose mild traumatic brain injury, but one of the sources where we can get some guidelines and some understanding of how mild traumatic brain injury is defined is from the American Congress of Rehabilitation Medicine and the diagnostic criteria for mild traumatic brain injury. This is an article published in 2023 that helps us look at different criteria to help guide the diagnosis. So one of the things that we want to evaluate when we see somebody who might have sustained a mild traumatic brain injury, also called a concussion, is we want to understand whether there's a plausible mechanism of injury. And what this slide shows is the different mechanisms by which you can sustain a mild traumatic brain injury. First, you can have your head being struck directly by an object, or secondly, you can directly strike your head on the object. Another mechanism is what's called an acceleration-deceleration injury, or some people call it a coup contra coup injury, in which the brain inside the skull is actually hit from front to back or side to side or from corner to corner against the hard inner part of the skull. And the final plausible mechanism by which you can sustain a mild traumatic brain injury is from a blast injury. So once you've surpassed the idea of having the appropriate mechanism of injury, the next thing is to look for clinical signs. And clinical signs can be divided, as shown here from the American Congress of Rehabilitation Medicine criteria. The first potential way you can meet the definition of a mild traumatic brain injury is a complete loss of consciousness. The second way is an alteration of mental status. In other words, you can be dazed and confused. And the third way is to have some kind of amnesia for the event. In other words, you can't remember from one spot at the time of the event to another. Many clients will say that they remember getting hit by a car, but the next thing they know, they were on the ground. So the evaluation of whether an individual meets the criterion for the definition of a mild traumatic brain injury is usually done in the acute period. You can look at the acute period of medical documents, you can get witness observation, or you can get the testimony of the individual themselves as to whether they experienced any post-traumatic amnesia, being alteration in consciousness, or loss of consciousness. Once you identify a mild traumatic brain injury, there are 3 to 6 buckets that you can evaluate to see how the individual has been affected. You can look for cognitive or thinking. You can look for physical, things like headaches, eye problems, hearing problems. And then you can look for emotional, things like mood disorders, depression, anxiety, and being more irritable. Finally, you can look at how people interact socially. You can look at how people work vocationally. Oftentimes, they are unable to work as effectively. And then you can look at people medically. There's actually been studies that show there's an increased mortality rate after a traumatic brain injury. So obviously these reviews can't discuss every single aspect of anyone's injuries, but hopefully this overview has helped you gain a better understanding of the anatomy, how injuries can be diagnosed, treatment options, as well as the future prognosis. Thank you for your attention.